Good day and welcome to the second session of the series of introductory sessions for the paper of post-graduation diploma in counseling and guidance. So in this paper today we are going to talk about, in this series of papers, today we are going to talk about the second paper. In the last session we discussed about the first paper, which spoke about principles and procedures of guidance. In this paper we are going to talk about approaches and techniques of counseling. So let us start with today's session, in which we'll talk about the paper in totality. What are the objectives that we are trying to achieve through this paper? What is the syllabus of this paper? And we will run through each and every unit, in which I will explain what are the various contents of the unit and what would you learn at the end of every unit. We will also cover what are the various skills and techniques that you will be able to learn or acquire at the end of each unit, and how you will be able to apply these skills and techniques in your organization or in your counseling process. We will also talk a little bit about the various reference books that are available for you in order to understand and study more about this paper. So starting with this paper, the first thing is, let us understand what do we mean when we say approaches and techniques of counseling. We had spoken a lot about guidance and what do we mean and what do we do as providers of guidance as psychology students. Now, when we talk about counseling, I think I had covered a bit of counseling and how counseling is different from guidance in the previous session, but we will also have we will also kind of run through this again in this session today. So let us start today's session also with a case study. Let us assume that you are seeing a person. So there's a couple that is coming to you. The couple has lost their child because of a terminal illness, and the mother of the child is having difficulties in carrying out the day-to-day activities. She is having difficulties in following her daily routine. She is having difficulties in carrying out the tasks which she used to be able to do very easily when her child was alive. So the father has brought the mother to you, and they both of them expect you to help them to get their lives back on track. So what you as a counselor would do in this with this client is something that we are going to cover in today's paper. So at the back of the mind, please remember this case when we are seeing each of these units, and we will talk about how we as counselors are going to help this couple throughout the process of counseling. We'll also talk about what are the techniques and how you will apply these techniques when you are working with this couple. What are the various theories, what are the various therapies that you are going to use when you are going to help this couple regain their lost confidence, regain their lost momentum due to a certain event or a crisis situation that has happened in their life. So this brings to the objectives of our paper today. In today's paper, we are going to focus on understanding what is counseling, understanding what is psychotherapy, and clarifying what are the differences between counseling and psychotherapy. That is the first objective of this paper. The second objective is to understand the process of counseling. So in the last session, I had spoken to you about how counseling is a lengthy process. It goes on for a period of time, and every session or every stage of counseling has a specific purpose to achieve. So we'll understand what are the steps that are involved in counseling, what is the significance of each step, and why we need to follow this certain process when we are doing counseling. The third thing that we are going to talk about is what are the skills and techniques that we will require as counselors, and how these skills and techniques would be applied to the settings in which we are working. The fourth thing that we are going to study, or the fourth objective of this paper, is to understand the different settings or different ways in which we can provide counseling. So in this paper, we are going to focus on three types of counseling. The first is individual counseling, the second is group counseling, and the third is career counseling. So we spoke about vocational guidance in the last session. Career counseling may sound very similar to vocational counseling, vocational guidance, but there are certain nuances, certain differences in this in career counseling and vocational guidance that we are going to see in this. These are the four objectives that we are going to cover in this paper, which is approaches and techniques of counseling. So let us start by talking about each unit in detail. This brings us to the first unit. So in the first unit, the title of the unit is Introduction, and as the name suggests, this is basically an introduction to the various concepts that we are going to use in counseling. We'll talk about definitions, we'll talk about terminologies in this unit, we'll talk about counseling and psychotherapy, and what are the differences or core differences between these two concepts. We'll also talk about what are the various external factors that influence the process of counseling. So obviously client and the client and the counselor are two most important components when we talk about counseling. However, there are certain external factors that are going to impact the process of counseling, and we are going to talk about them in detail. We will also talk a little bit about ethics and values of therapeutic process. So coming to the definitions, what is counseling? Counseling is basically a relationship that is developed between the client and the counselor, wherein the client has come to you to receive help because the client wants to overcome certain situations, certain events in his or her life. The client also wants to overcome certain negative emotions or feelings that is hindering the positive growth of his or her personality. And the counselor, on the other hand, is an expert because the counselor understands human behavior. The counselor understands what are the various factors that can bring about positive or negative changes in individuals' behavior, thinking, emotions, and personality, and help the client achieve his or her particular goals. So what do we aim at the end of the counseling process? So in order to say that the entire process of counseling has been successful, we need to achieve certain objectives. First objective that we need to achieve is to bring about a positive change in the behavior of the client. The second is promote decision making. The third is to help the client realize his or her potentials to the fullest extent. The fourth is improve or enhance the coping skills of the client. And the fifth is to improve the relationships or the interpersonal relationships that the client has. Now we were talking about the previous case in which let's name Miss S. Miss S has lost her child and she is having difficulties in her day-to-day activities in functioning at an optimum level, and and the couple has come to you. So when can you say that your counseling has been has been successful? So in order to do that, you need to achieve certain things. So when we talk about positive behavior change, let's say for example, Miss S has not been able to follow a certain schedule. So at the end of the process of counseling, you must ensure that the activity schedule or the activity level of her is improved, and she is able to achieve the number of activities that she wants to do on a day-to-day basis. Promote decision making. So there have been certain changes that has been taken place in her life because she has lost her child, and she has to take decisions regarding as to what to do about her future. So if she is able to take concrete decisions, also small decisions on a day-to-day basis needs to be taken care of. So if she is able to do it positively, if she is able to do it confidently, then you can say that the counseling process has been successful. The third is to realize the client's potential. For example, let us assume that she was a working professional before, and now she is not able to continue her job. So if you help her regain her confidence and go back to her vocation, then that is also an indicator that the counseling process has been successful. Enhance her coping skills and improve relationships. So because of the loss that she has experienced, she is not able to cope up with this particular part of her family that is missing. Her relationships with her husband and her family members have also been affected. So through this counseling process, you need to address these areas and help her cope better with her surroundings, and also maintain positive relationships with people around her. So this is the concept of counseling, and these are the various areas that counselors address when we work with our clients. The second terminology that we often use is psychotherapy. So psychotherapy is a treatment process which helps people who are dealing with psychological issues like depression or anxiety. Now this brings us to a very clear difference between counselors and psychotherapy. When we say that we are doing psychotherapy, we work with clients who have been given a diagnosis. When we work as counselors, counseling may not require a specific diagnosis given by a doctor or a psychiatrist. But a psychotherapist will work, psychotherapy means that the person has been given a diagnosis and has been taking treatment for that particular psychiatric condition. The process of counseling and psychotherapy may sound similar. However, the distress that is experienced by the clients in counseling and psychotherapy is different. We have spoken about these terminologies when we have understood what are the various differences between counseling and psychotherapy. We'll talk a little bit about the various factors that affect counseling or psychotherapy. The first thing is initiative. Initiative in the sense there are two types of clients. The first type of client is a person who has come to you on his or her own will, which means that the person is aware that there is certain kind of difficulty that he or she is facing, and the person actively wants to resolve that difficulty or the event. The second thing is when the person is brought by someone else. So in this situation, the person himself or herself does not either realize that there is a problem, or even if the person realizes that there is an issue, does not want to overcome or does not want to resolve the issue because the problem is because the person is benefiting somehow from this problem. So for example, for a student who is not able to, who has, let's say, learning disabilities and is not able to cope up with his studies. So the child knows that he has learning disabilities, but he does not want to overcome his disability because he feels that it will reduce the burden of studying. So according to this child, the problem is actually not a problem. So he knows that he has learning disability, but somehow the child is benefiting from this learning disability and hence does not want to overcome. So now both of these clients, a willing client and an unwilling client, will have different levels of acceptance of you as a counselor, and the impact of the process of counseling will be different for both of these clients. Then the second is physical setting. Physical setting is important because uh, we as counselors will work in different areas. We may work in hospitals, we may work in schools, we may work in family or family based organizations. We may also work in rural or tribal settings or urban slum settings. Based on the setting, based on the physical environment that is available, the client can either feel comfortable or uncomfortable in sharing their personal information. Sometimes in certain situations there is lack of privacy, in which kind of stops the client from sharing intimate information to you with the counselor. Sometimes what happens is the family accompanies the client, and there is no separate room in which the family can sit, and the counseling will happen in front of the family members. So even if the room is isolated, because there is presence of family members or other known members, the client may not feel as comfortable as he or she would be on one-to-one levels with the counselor. Also, when we talk about physical settings, we need to ensure that there are no sharp objects, there are no ways in which the client may cause self harm, because if the client is having depressive symptoms, if the client is having positive symptoms of certain psychiatric conditions, then there are very high chances that the client may engage in self-harm behavior. So security, safety of the client and the counselor both are equally important, along with privacy and intimacy during the counseling process. Then we spoke about unwilling clients and we spoke about willing clients. We also need to understand that the counselor, the various qualities of the counselor may also impact whether the process of counseling will have a positive or a negative impact. We'll talk about this various skills or qualities of the counselor in detail in the coming units. We also need to understand that the relationship between the client and the counselor is another important factor that is going to impact the process of counseling. So we spoke about nature of clients, we spoke about the settings, we also spoke about the relationship that has been developed between the counselor and the client, that as some of the factors that are going to impact the process of counseling. This brings us to the next topic of this is something that we are going to cover in the first unit. We'll also cover values of counselor, which means that we have to be non-judgmental, we have to be empathetic. However, these will be covered in detail in the coming units, and we'll discuss then when we are speaking about those units. So now let us talk something about the process of counseling. Counseling, guidance or psychotherapy is a very systematic process. We need to follow certain steps when we are doing counseling or when we are doing psychotherapy. So we have a list of 6 basic steps that we will follow. The first step is called opening. Opening in the sense it is the first interview that you have with the client, the first time the client is meeting you. There are certain things that you need to do in this session. The first thing is you need to establish the relationship with the client. You need to establish a contract of confidentiality. You need to establish the fact that whatever has been spoken in the session will not be shared outside unless it has an educational value, or it is related to the client's welfare or benefit. Here we also take a brief interview or a brief we kind of take the brief history of the client, the problem that the client has come with, the impact of this problem on the client's life, what has the client done about this problem in the past, and if the client has had any positive results when the client has tried out any maybe self-counseling or any method that the client has tried before. So this will give us a brief idea about the client and his or her concerns. Now every organization will have a pro forma or a questionnaire which will cover these basic issues, which will cover these basic questions, and in this stage you can gather as much information as you can without making the client uncomfortable. So this will help you make a diagnosis, or not basically a medical but a psychological diagnosis of the client's problems. Then the second stage is where you understand or where you try to explore client's understanding. So how you perceive the problem will be different from how the client perceives the problem. If you see a certain aspect as a problem, it does not mean that the client is also seeing that aspect as a problem. So you need to understand what the client feels and thinks about his or her situation, and then you need to explain what is your understanding about the situation. So there could be similarities, there could be contradictions between your and client's evaluation of this particular situation. The fourth stage is intervention. So after you have had a gist of what the client is facing, what are the various problems of the client, you can also you need to make a list of steps you as counselor are going to follow. So you need to check out what theories you will apply, what are the various aspects of different therapy you are going to use with the client. So this is called intervention. Now during this process you will understand that you want to use a certain approach, and through that particular approach, so let's say you are using behavior therapy, so you will try to explore the problems using that therapy and also provide solutions which come under behavior therapy. If you are using a client-centered approach, then you will try to find out the problems of the client using this approach and provide solutions that are appropriate to this client-centered approach. Now you can use, there is no need to use only one therapy or only one mode of intervention. You can always use different aspects of different therapy which suit the client best in that particular situation. So now when we have spoken about the different steps of counseling, we'll talk about the various qualities that are essential to be a good counselor. As a counselor, you need to be a good listener. You need to as a counselor, you need to be patient with the clients. You need to be empathetic. You need to have an integrity towards what you are saying. So there shouldn't be contradictions between your actions, your thoughts, and your speech. You need to be open-minded and accepting and non-judgmental of the client. So there are certain skills that you need to learn, or that will be covered in the second unit of counseling. The first is skill of asking questions. What kind of questions you need to ask, how you need to frame your questions, what are the certain things that you should avoid asking, what the verbatim in which the question is asked. Then the second skill that you need to learn is the skill of listening. In skill of listening, you need to understand that there are various levels of listening. The first level of listening is superficial listening. The second level of listening is where you can where you go beneath the words and try to understand how, from the gestures, from the pauses, from the silence of the client, what he or she uh, wants to convey to you as a counselor. You also need to learn the technique of reflecting. Now, reflecting is basically where you as a counselor help the client to see what is the impact of their actions. You also need to learn the skill of affirmation, wherein you provide positive support to the client, or when you affirm the problems, the difficulties that the client is experiencing. When we spoke about the qualities, we have to be empathetic. So empathy is another skill that we need to develop. Non-judgmental attitude is also a skill that we need to develop as counselors. And client's self-disclosure. This is a very interesting skill. When we talk about client's self-exposure, what we mean is that the client, when comes to you as a professional, they are giving a lot of information about themselves. So it is like they are trusting you completely to the point that they are sharing very confidential issues. They are sharing their very innermost thoughts, emotions to you as a professional. Now, sometimes during this process, there will be certain instances where you as counselors are going to share your opinions, are going to share your feelings. You're also going to share certain information that will be very personal during the process of counseling. It is important to know what to share, how much to share, when to share, and also what not to share. So when you're talking about yourself during the process of counseling, it basically helps to build the confidence of the client onto you, but it should not be to an extent where the counseling sessions becomes about you and not about the client. So there has to be a very thin balance that has to be maintained when you are doing self-exposure on your part as a counselor. So this is basically the gist of the second unit, wherein we'll talk about the processes, the skills and the techniques that we as counselors need to understand and need to learn. The third, fourth and fifth unit will basically talk about the different forms or settings of counseling. The third unit will talk about individual counseling. The fourth unit we will talk about group counseling, and the fifth unit we are going to talk about career counseling. So what is individual counseling? In simple terms, as the word suggests, individual counseling is when a counselor and a client meet on a one-to-one basis. So there is one-to-one discussion between the counselor and the client, and they both form this professional relationship in which the client is being helped by the counselor to resolve his situation or to overcome the problems that he or she is facing. Now, when we talk about individual counseling, it may involve two or more people also. So when we talk about couple counseling, it also becomes kind of individual counseling, but it is a couple, so it is kind of a unit. So it is not just one person but also about a unit. So when we're talking about family counseling, it also becomes a part of individual counseling, because we are seeing this entire family as a unit and not different individuals that have come to you. So individual counseling may also involve couple counseling. It may also involve family counseling along with individual counseling. The steps that are involved in the individual counseling are very similar to what we have spoken. However, the therapies that we will talk about will be different in individual counseling from group counseling and career counseling. So when we talk about individual counseling, we basically talk about three important therapies. So the first therapy that we talk about is the behavior therapy, which is given by Alfred Adler. Now you would be asking me that, why are we starting from behavior counseling? Why are we behavior therapy? Why are we not talking about psychodynamic therapy, which was by Sigmund Freud? So in recent times, very few counselors use psychotherapy or psychoanalysis. One of the reasons being that it is a very lengthy process, and clients may not be willing to come to you for such a long time. You see, clients are paying, and in India we don't have insurance coverage for counseling sessions. So even though you might wish to use pure psychoanalysis, there are certain practical aspects which may not make it possible for you to use this particular form of therapy. So we mostly use behavior therapy because it is time bound. So there are 8 to 12 sessions, and the client will be able to come or commit to continue the therapy for this particular number of sessions. The second is, we talk about cognitive therapy, which is by Aaron Beck. And the third is client-centered therapy by Carl Rogers. So these are the three therapies that are used extensively in individual counseling. Each of these therapies explain the problem in a specific way. So for example, behavior therapy will talk about the reinforcement that the client is getting by following a certain negative behavior, and hence the negative behavior is maintained or is not wearing off. Then the cognitive therapy will talk about the underlying beliefs of the client, which is leading to negative behaviors, and how you can change those core beliefs so that the client can embrace positive changes in his or her behaviors. The client-centered approach talks about acceptance, talks about empathy, talks about how the client himself or herself can bring about a positive change if the energy of the client is channelized in a positive manner. So each of these therapies is time-bound. Sessions mostly are ranging from 8 to 12 sessions, with sometimes even more if the client has major problems, but mostly 8 to 12 sessions, which mostly once a week or twice a week you meet the client and you conduct counseling or therapy with the client. Then we talk about group counseling. In group counseling, there are two types of counseling. The first is where you are a counselor or you are at a position of higher authority or higher educational or skill set, and you meet a group of people wherein you help them resolve certain common issues or concerns. So let's say you are having a group of people who are suffering from schizophrenia, or you are meeting a group of children who is suffering from learning disability. So the group has a common problem. You have skill sets or you have you have an authority because of your educational background to address that particular issue, and you meet these people over a period of time to help them achieve a goal. So for example, you meet these children who are having learning disability to help them learn a particular skill. So it could be communication skills, it could be vocational skills. So you're meeting them throughout this process. So this is one aspect of group counseling. The second aspect is called peer counseling. Here there is no difference between the counselor and the client. Here, there are people or peers who have certain common problems come together and they discuss about their problems and they come to a solution or help group members overcome their difficulties. So let's say, for example, there is a support group for parents who are having children suffering from cancer. So there are children who are suffering from cancer. Their parents have come together and they have formed a peer counseling group. Another example is wherein you have people who are having addiction, a specific addiction, and they have come together and they have formed this group and they are conducting counseling sessions. So this is peer counseling. This is also a part of group counseling, but the way it functions is very different from group counseling. Then the last is career counseling. Career counseling is similar to career guidance. However, career counseling is a broader term, because when we talk about career counseling, we work with many different types of clients. We work at different levels. So we work at school level, we work at college level, we work at organizational level. We also work with people who are having specific difficulties. So we work with the people who might be having physical disabilities. We may work with people who are having learning disabilities. So we work with, so the scope of career counseling is much broader than the scope of vocational guidance. Also, vocational guidance may sometimes only limit to one session. On the other hand, career counseling will span across different sessions. So you will have different activities that you will take across this process of career counseling. You may engage in conducting various psychological tests. You may also engage in conducting mock interviews. You may also engage in practical implications of the skills that you want to teach your client as a process of career counseling. So career counseling will basically help the client understand him or herself better, and also understand the scope or the world of employment, and how his or her educational qualifications can be used in the vocation that he or she is going to work in future. So this is basically career counseling. In this unit, you will talk about your role as a career counseling with students at middle school, with students at secondary school. You will also talk about vocational guidance in terms of vocational counseling, in terms of the different skills that are necessary, in terms of how a person with let's say learning disability or physical disability may still acquire employable skills and gain meaningful livelihood for himself. So these are the 5 units of this paper. There are certain books that you need to refer while you are studying for this paper. The first one is Counseling Counseling Theories and Practices. It is an Indian publication which is by Jeffrey Kotler and David Shepard. Then there's another book that is Introduction to Counseling. This is a foreign publication. Then there is theories of counseling and psychotherapy, which is an integrated approach. Again, this is a foreign publication by Corey G. There's theory and practice of counseling and psychotherapy, and there's one last book which is Basic Counseling Skills, a Helper's Manual, which is by Nelson Jones. Most of this book should be available on Google Books, but I hope they are available in your library as well. You will also be able to get material for studying online about the various therapies that you will be using with your clients in different settings. So this was kind of a brief overview of the paper, approaches and techniques of counseling. Studying these techniques is one thing and applying these is another. So you need to always remember, while you're studying these techniques, always think of situations in which you can apply these therapies or these techniques. This will kind of help you remember them when you are going in your settings, or when you are going to meet your clients. Another important thing is, before meeting your client, you can always brush back your theories before every session if possible, so that you can use those therapies, or you can use those techniques that are shown in the various theories of counseling. When using these theories or these therapies or techniques or whatever you call them, you need to understand that every client may not benefit from every technique. So there are certain techniques which you need to use depending on the nature of the client, the nature of the problem, and how the client is willing to process the information that you are giving to him or her. Every client will respond to your therapy in a different way, and hence you need to be open enough to change the direction of therapy midway if required, because the client welfare is more important than sticking to your therapies or sticking to your perspectives of counseling. Thank you very much, and we'll see you next time for the third session on this series, which is based on personality and adjustment. So thank you very much.